The IBIS-2 trial, anastrozole and breast cancer prevention. Welcome to the Everything Surgery podcast, where we dissect the extraordinary in medical science. Today, we delve into the International Breast Cancer Intervention Study 2, commonly known as the IBIS-2 trial, which examines the use of anastrozole in breast cancer prevention among postmenopausal women who are at high risk. The core objective of this landmark study was to determine whether the aromatase inhibitor anastrozole could effectively prevent breast cancer in postmenopausal women identified as having a high risk. Researchers also aimed to compare its efficacy and side effect profile with the well-established preventive agent tamoxifen. Led by an international consortium and coordinated from the United Kingdom, the IBIS-2 trial recruited participants between 2003 and 2012. The trial involved a total of 3,864 postmenopausal women, all considered high risk due to factors such as a strong family history of breast cancer, atypical ductal or lobular hyperplasia, lobular carcinoma in situ, significant benign breast disease, or high mammographic density. The study utilized a randomized, double-blind, placebo-controlled design to compare anastrozole with placebo. Participants were assigned to receive either 1 mg of anastrozole daily or a placebo for 5 years. The planned follow-up extended for 7 years after randomization, comprising 5 years of treatment and 2 years post-treatment. Results published in 2013 revealed that after a median follow-up of 5 years, anastrozole significantly reduced the relative risk of all types of breast cancer, including both invasive cancer and ductal carcinoma in situ, by 53% compared to placebo. The reduction in invasive breast cancer specifically was 50%, with the greatest impact observed in estrogen receptor-positive tumors, which saw a 58% reduction. Long-term follow-up results, published in 2020 after a median duration of nearly 11 years, confirmed that the protective effect of anastrozole persisted. The relative risk of all breast cancers remained reduced by 49%, indicating a continued benefit even after discontinuing the drug. Although the number of deaths from breast cancer was small, a strong trend towards reduced mortality was observed in the group receiving anastrozole. Regarding safety and tolerability, the side effects reported were consistent with the known profile of aromatase inhibitors. Participants taking anastrozole experienced more musculoskeletal symptoms such as joint pain and stiffness, as well as hot flashes, hypertension, and dry eyes. Importantly, there were no significant increases in life-threatening events, including non-breast cancers, cardiovascular disease, fractures, or overall mortality. Furthermore, anastrozole did not cause an excess of venous thromboembolism, endometrial cancer, or cataracts, serious risks associated with tamoxifen in previous studies. The IBIS-2 trial, alongside the MAP-3 trial for exemestane, provided conclusive evidence that aromatase inhibitors are highly effective for breast cancer prevention in high-risk postmenopausal women. The 10-year follow-up data reinforced the lasting protective benefit of 5 years of treatment, strengthening the case for anastrozole as a first-choice preventive therapy. This is especially relevant for women who have a uterus or are at risk for blood clots, making tamoxifen a less suitable option. The findings from IBIS-2 have been incorporated into major international guidelines, such as those from the American Society of Clinical Oncology and the National Comprehensive Cancer Network. Today, both anastrozole and exemestane are recommended as standard options for chemo prevention in this population. In summary, the IBIS-2 prevention trial demonstrated that anastrozole is a highly effective agent, reducing breast cancer risk by about half in high-risk postmenopausal women. The benefit persists for years after treatment stops, and it offers a side effect profile that avoids the serious risks associated with tamoxifen. Thank you for joining us. If you appreciate thoughtful discussions on cutting-edge medical research, please like, share, and subscribe. This has been the Everything Surgery podcast, where we bring you insights into the extraordinary world of medicine.